Cassie. Hi, Mr. Smith. My name is Shaylin. I'm going to be your student nurse today. Can you tell me your name and your date of birth? Okay, now look at his bracelet and everything matches, so I know I have the right patient. And Mr. Smith, do you have any allergies that you're aware of? He says he does not, so we're good to go. Okay, Mr. Smith, today I'm going to be changing the dressing around your PICC line here. We'd like to change it every 7 days, just to make sure that we prevent any infection. Are you going to be able to hold your arm still for me while we perform this? He says he can. And also during the procedure, in order to maintain being sterile and try to prevent infection, I'm going to ask will we both wear masks, and that are you able to tolerate? He says he will. If this was a patient who maybe is confused or has anxiety and they're not able to, for any reason, I would have them turn their head away from the site to prevent any exchange of germs. Okay, so now that we've done all that, I'm going to go ahead and actually look at your site. First, I'm going to wash my hands and get this open. I'm going to put on my mask right away, wash my hands, and I'm going to get Mr. Smith his mask. And I'll wash my hands. That way our kit is open and ready to go. Okay, so I'm going to don clean gloves so I can look at the site. And the first thing I'm going to do is I'm going to measure. And what I'm measuring for is, first of all, I'm measuring about 6 inches above the insertion site. We're going to measure arm circumference. Okay, good. It matches baseline. And then we're going to measure how much of the catheter is out. Okay, good. And that also matches baseline. So what I was doing to measure that is I was measuring to make sure that all the numbers matched. Because if it was more than a 1/2 inch difference, it may indicate phlebitis or infection, and that would not be good. Okay, so I'm now going to look at the site and feel around. I'm assessing for any redness, ecchymosis, drainage, checking to make sure that it looks approximated, all that stuff. And Mr. Smith, when I'm touching, is any of this tender? He says it is not. So the site looks good, and it looks like we're ready to go ahead with our dressing change. Okay, so I'm going to now remove the old dressing, and I'm going to peel up around the edges. If this were somebody elderly, I may have some alcohol prep to help this come off a little bit easier and a little more painless. I may have a second person come help hold the arm too if I needed. Mr. Smith, are you doing okay? Good. I'm going to make sure to be careful here and move towards the insertion site so I don't get gonna hold down here just so I don't pull. Okay, perfect. All right, so now I'm going to assess the dressing. I'm going to look for any color, odor, consistency, and amount of any drainage that may have happened, and I don't see any, so that's good to just go in the garbage. Okay, so that's thrown away. I'm now going to just kind of not touch, but just inspect to make sure that it looks well approximated and that there's no more drainage now that I've put the dressing. Okay, it looks good. Looks like we're ready to proceed. You're still doing okay, Mr. Smith? Yes, he is. I'm going to remove my gloves. I'm going to wash my hands. Pull up my sleeves, wash my hands again. Get rid of this drape I won't be needing. Grab out my sterile gloves. Being sure not to reach over the other glove before I put it on. Okay. I'm going to be sure not to put my hands below my waist now that I am sterile. So now what I'm going to do is I'm going to clean the site with the alcohol. So I'm going to grab my tweezers and alcohol. I'm going to use the tweezers just to lift up the line so I can clean in a circular motion from the insertion site out, cleaning up any blood or any drainage that may have been left behind, making sure not to make my way back towards the insertion site. Throw that away, grab my facility approved cleaner and activate it, and then going to apply friction and rub in a back and forth motion all the way around the insertion site. If this for somebody elderly or with fragile skin, I might have to apply a little bit less pressure to avoid skin tears. And we're going to do this for 15 to 30 seconds. Okay. All right. And then the last step is to grab my skin prep. After that has dried, I'm going to apply the skin prep in a window direction. Okay. We're going to want to make sure we let that dry all the way before we proceed with putting on our dressing. So it has now dried. I'm going to grab my dressing. I'm going to make sure that the insertion site is in the middle. Making sure to only touch around the edges. Have him lift his arm for me. Thank you. Okay, and then this outer layer of tape comes off. Making sure we get that dressing flush against the skin. Okay. Okay. And I'm going to use this extra piece of tape on the bottom. I'm going to initial it and date it. And I'm going to put it on the bottom for a little extra support, making sure to avoid the main section. Okay, so now that the clean dressing is on, I can remove my sterile gloves and wash my hands. Mr. Smith, we're done with the procedure, so you can now remove your mask. I'll help you. So he's removed his mask, wash my hands, take off my mask, wash my hands. And I'm noting that the dressing looks good, it's intact, it's all well approximated. So Mr. Smith, how are you feeling? Okay? Can I get you anything at all? No? Okay. And make sure the bed is back into a safe position. And then I'll go ahead and leave the room, clean up my mess, and document the dressing change, the time, how he tolerated, all of the assessments I did regarding ecchymosis, the dressing, and the site assessment, and as well as the measurements to make sure that it's all documented for the next change. I'll wash your hands.